My name is Sarah, and today I'm going to talk about depression. Depression is my topic, and all about depression is that depression is a situation where someone feels sad, someone feels stressed, and someone feels like that person doesn't have hope about maybe their sexual differences and their expectations in life that makes them get depressed, because sometimes they ask themselves questions, they don't get answers. And my videos and the links I have will give you more details about depression, the causes, and how we can cure depression, and how we can encourage people who are suffering through depression.
You've probably come out of a particularly sad movie and said something like, "Man, that was depressing." In this case, you're talking about how, at that moment, the movie made you feel sad, discouraged, hopeless, or anxious. You probably wouldn't say something like, "Man, that movie was clinically depressing." The latter expression refers to a much different state of depression. Clinical depression, which is sometimes called major depressive disorder or unipolar depression, is a serious mental disorder that has a lifetime incidence of up to 20% in women and 12% in men, making it one of the most common reasons people seek out mental health services. That being said, as well as being relatively common, clinical depression is, in fact, very serious. It's so serious that it interferes with someone's day-to-day life, like working, studying, eating, and sleeping, essentially leading to this overall feeling that life isn't enjoyable. But what causes someone to feel this way? Well, we don't exactly know what specifically causes clinical depression, especially since it can be so different between patients. It's probably a combination of factors, though, like genetic factors, biological factors, environmental factors, and psychological factors. It's been shown that people with family members who have depression are 3 times more likely to have it themselves, and this link seems to increase with how closely related family members are. Biologically, though, most medications focus specifically on neurotransmitters. Neurotransmitters are signaling molecules in the brain that are released by one neuron and received by receptors of another neuron. When that happens, essentially a message is relayed from one neuron to the next.
I'm Dr. David Thomas. I'm a practicing psychotherapist with the Whitford Thomas Group in Tampa, Florida, to discuss high anxiety symptoms. High anxiety, at least in my frame and my thinking, is an extreme form of anxiety. We tend to see that when we diagnose panic as well as anxiety attacks. So if we look at high anxiety being a more severe form of anxiety, you can kind of liken it to all your anxiety symptoms that oftentimes kind of come and go or kind of transient, tend to kind of emerge all at one time in the system. What are some of those symptoms? Well, certainly when we look at anxiety and we talk about fear, there's a rush, a kind of a hyper sensitivity in the system. Oftentimes what you see is the heart, the palpitations tend to be very fast, kind of a racing heart, racing ideas, skin moisture, tend to see a lot of tension in the head, muscle aches, stomach problems, restlessness, sleep disorders, a sense of doom, a sense of wanting to run, isolation, concentration issues and things of that sort as well. So when we have this kind of heightened or this kind of high anxiety symptoms, it's almost like all these symptoms kind of merge at one time in the system and produce a very severe or dramatic effect. Treatment-wise, it's pretty much the same, cognitive behavior psychotherapy with or without medications. At that time when you're experiencing a high level of anxiety, you probably want to learn different breathing techniques, relaxation techniques, so you can very quickly bring the symptoms down. With a little bit of work and help, you can certainly focus on the thinking that drives the anxiety, but without some prior training, it's kind of tough to focus on challenging and disputing the thinking at that time. We do that mainly in our practice with cognitive behavior psychotherapy. Well, I hope this information has been helpful regarding high anxiety. From Tampa, Florida, I'm Dr. David Thomas.